The sacrum is a triangular shaped bone located at the inferior end of the spine. It is wedged between the two ilia and makes up the posterior portion of the pelvic cavity. Anteriorly, the sacrum has a concave shape. Posteriorly, it is convex. This curved shape allows more room in the pelvic cavity for organs such as the bladder, reproductive organs, colon, and rectum. It is one of the several bones that provides support to the upper body. Another cause for the sacrum's shape is due to its 4 points of articulation. Superiorly, the sacrum articulates with the last lumbar vertebrae. Inferiorly, it articulates with the coccyx, and laterally, it articulates with the two ilia. The sacrum is a unique bone as it starts with 5 separate vertebras until it fuses between the ages of 16 and 18. By the time a person has reached age 34, the bones have completely fused to create one large bone. Superiorly, the sacrum consists of a base which has an oval articular surface, the body, and the apex, which articulates with the coccyx. The coccyx is also known as the tailbone and consists of 3 to 5 coccygeal vertebrae. Looking at the anterior surface of the sacrum are 2 wing-like projections known as the ilia. In between each ilia is a prominent projection of the base of the sacrum known as the sacral promontory. Inferior to the sacral promontory are 4 transverse ridges, which are the site where the 5 sacral vertebrae fused. On each side of the transverse ridges are 4 anterior sacral foramina, which make it a total of 8. Sacral nerves and arteries pass through these foramina, and the foramina also become smaller from the top to bottom. On the posterior surface, in between the two ilia, is the entrance to the sacral canal, which holds the long sacral roots of the spinal nerves. It follows the body of the sacrum down to the sacral hiatus. The hiatus is formed when the lamina of the 5th and sometimes the 4th sacral vertebrae do not completely meet. Superficial to the sacral canal is the median sacral crest. This crest is formed from the spinous processes of the 5 sacral vertebrae that have been fused. On each side of the median sacral crest are 4 posterior sacral foramina. These foramina appear much smaller and less regular in arrangement than those on the anterior view. These foramina conduct the posterior divisions of the sacral nerves. On each side of the posterior foramina run the lateral sacral crests. These lateral sacral crests are formed by the transverse ridges of the 5 sacral vertebras. The sacrum is noticeably different in males and females. In males, the sacrum is longer and narrower. In female, the sacrum appears much shorter and wider. This increases the size of the female pelvic cavity for childbirth. One of the most common causes of lower back pain is due to the sacroiliac joint, which is known as sacroiliac joint dysfunction. The sacroiliac joint is a synovial joint that is between the auricular surfaces of the sacrum and the 2 iliac bones. Although the cause of pain from the sacroiliac joint is unclear, it is thought that an alteration of normal motion may be the cause. Some people can develop this due to an injury to the pelvis or repetitive stress such as running. The fact that the sacroiliac joint dysfunction remains difficult to diagnose, an anesthetic injection is specifically applied to the joint for the relief of pain. The sacrum gets its unique name from the Romans who named this bone the os sacrum, which translates to holy bone. One of the many reasons as to why it was named the holy bone is that the ancients noticed that the sacrum was the last bone to rot after death, and believed that it would be the focal point around which the body could be reassembled in the afterlife. This video was prepared as part of the course requirements of Human Anatomy at Saddleback College.